In today's video, I show you how to identify plantar vein thrombosis on MRI of the foot or ankle, what it looks like, what to look for, and also the underlying anatomy of these veins in order to describe the findings properly. My name is Dr. Christoph Agten. I'm a musculoskeletal radiologist, and in my YouTube channel, I teach you MSK radiology. Now, so for the plantar vein thrombosis, let's jump right in. Okay, so let's start first with the relevant anatomy here of the plantar veins, because we need to know the anatomy in order to describe where we are actually seeing something that looks like a thrombosis. This is just a rough scheme here of the underlying venous system of the plantar aspect of the foot. So, when we start at the toes, you can see there we have the plantar digital veins. They are small, veins on either side of the toes, very small ones. So we are not really caring about them too much. I don't think it's the right study, MRI, to actually find thrombosis here in this region, although we will have a look at a case which is kind of like borderline here. But yeah, they're not relevant. We don't really see them on MRI anyway, so I think we can even say we just forget about it. But the relevant next veins, so basically the toes drain into the plantar digital veins, and then the plantar digital veins drain each into separate plantar metatarsal veins. So we have for every metatarsal bone we have one. I think in the greater toes some illustrations show two, but we have these plantar metatarsal veins that are draining into the plantar arch, which is somewhere around the Lisfranc ligament, Lisfranc joints, or at the base of the metatarsal bone. So somewhere in that region. We will also have a look on MRI how that looks like. And then we have the medial plantar vein and the lateral plantar vein. So this is basically the two main large veins at the mid and hind foot. This is where we frequently see the thrombosis, or most of the time here in my experience. And then these two drain into the posterior tibial vein. Now this is just the plantar aspect of the foot. I'm not talking about the dorsal aspect of the foot here in this video here, which also contains some veins, but this is basically what we are interested in. Now, this is a view from below to the plantar aspect of the foot, but let's have a look at the like a side view or a lateral view, like here. Again, we have the toes with the plantar digital veins draining into the plantar metatarsal veins, then draining into the plantar arch, and which is about at the level of the Lisfranc joints, and then the plantar arch drains into the lateral and medial plantar veins, both drain into the posterior tibial veins. And keep in mind that these veins are typically, or at least in that region here, with two pairs of veins corresponding parallel to one artery. So if you see a couple of veins going down here next to each other, it belongs to them. So it's not like it's just one or so. So just something to keep in mind. Okay, so let's have a look at an MR here. So this is an MRI coronal PD FET set here of the whole foot. So basically long axis, and then here at the back, this is the ankle joint. We have the posterior tibial tendon, and then we have the posterior tibial veins and artery in the tarsal tunnel. So maybe we go there and make it a bit bigger. It's not the greatest resolution, but I think for the purposes here, that should be okay. Then we go, you can see the two veins here, and in the center, typically there's the artery. Now, this posterior tibial vein splits up into the lateral and medial plantar veins. So we can see it now here. They go down, and then we see the veins here. This is the lateral one. We don't nicely see the communications going over here. So there, this one, all the way down. That's the lateral plantar vein here. And then we have the medial one, which is running through here. So these are the two plantar or lateral medial plantar veins, these two. And when we follow them more distally, at the level of the Lisfranc joint, like I said, they form the plantar arch. We can see it's coming up here, and then it's going over. So basically they are connecting, and then they also go on the dorsal aspect of the foot, but that's not today's topic. And then here this way kind of like goes in and will also feed into the plantar arch. So the plantar arch is roughly at that level here. Something to keep in mind. And there's variability in terms of extent, arch, and all of that, as always, but this is just a general concept. Then from this arch that's going over here, there we have the metatarsal veins that are going off, more or less parallel to the metatarsal bones. You can see there are small vessels here in this foot here, like nothing too crazy. And once we reach the toes, basically they split up, and then we have these veins on either side of the toes. These are the plantar digital veins then here, which we are not caring about too much. So even if we try to find them, you know, it's the small stuff here that's going down. So these things. So we are not really interested in those. We mainly should start looking at the metatarsal veins. So we can see them here, maybe here, a little bit, depending on the phlovoids, etc. Difficult to see. Then they form the plantar arch, as we can see here. Sometimes we also have phlovoids, so it's something to keep in mind. But then that would be the plantar arch here, plantar arch, and then from the arch, when we go proximally, they go into the lateral plantar vein and the medial plantar vein. So these are the two main components here. You can see it, they go in, they blend in here. It's like plantar arch, lateral plantar vein, medial one, and the medial one here is kind of like not nicely going into this. So it's not really great illustration. We see some problem here with the plantar fascia, but you know, just to keep in mind that there is some variability happening. So now that we know the anatomy, it's important also to know what to look for. And before we do, just some quick points here. First, give the video a like if you haven't done so already. It helps me out in the long run. And also make sure to subscribe to my YouTube channel and click the bell button so you get notified whenever I upload a new video. And if you really enjoy and get something that you can apply in your clinical practice, and you really think these videos are helpful, consider to become a supporter of the YouTube channel. You can do this either as a YouTube membership or via Patreon. Both is possible. If you want to get more exclusive content, go over to the free radiology school community. It's a free platform for radiologists where we learn MSK radiology together. There's some exclusive stuff over there. You can get in touch with people from all over the world. So it's really great. So go check it out. But now let's jump right into the pathology here. So here we have a patient with ankle pain. We can see one pain marker here. I think there was a second one somewhere else down here. So it's kind of like pain in that region, plantar medial aspect of the foot. And you would then go through everything that you know already from all the other videos, ligaments, you would check tendons and all of that stuff. And just by scrolling through like this quickly, you would probably not notice much anyways, right? So even going through all the other stuff, you don't see like a major pathology that just jumps your eye. The joints are all okay, nothing fancy there. On the sagittal we can see joint, okay, a bit of fusion, but yeah, it's not like something that just jumps at you, right? But we need to be aware and have to have a high grade of suspicion or a very good eye to depict plantar vein thrombosis. So here in this particular case, when you look carefully here, there is, let me just make this a bit bigger. So there is the plantar vein here, the veins. We will focus on the terms here just in a second. And then there is some low signal stuff here, which looks atypical. This is not the typical phlovoid that you would see. It has also some perivascular edema around it, as you can see. So this is something that looks suspicious. It's abnormal, and this is actually a very nice example of a plantar vein thrombosis. Now, when we now think back about the on the name or the nomenclature, now we need to find out in which veins it is. So when we go back here, we can see this is the plantar arch here. So this is shortly after or distal to the Lisfranc joint. This is the plantar arch. So this is the posterior tibial vein. So we know we are on the level of the lateral or medial plantar veins. Now we just need to find out what to call it and which name to give. So we can either go on the lateral side, lateral malleolus, and then we just go here and we see this is the first vein that's coming. So this is the lateral plantar vein. Already by that we are sure about that. And then when we go here, we have the medial one, which we don't really see nicely. Maybe it's going down here. Now obviously we can always check second plane, which is should make things easier. So again, marker here, we can see some phlovoids happening also, first of all, in the artery itself, posterior tibial artery, the corresponding two veins. Then they go into the tarsal tunnel. And then, so up here, and then they split up into the lateral branch that's going down here and into the medial branch or medial plantar vein. So medial plantar vein, lateral plantar vein. And you can see the diameter is thick. There is periligamentous edema. Let me just go here and show this here as well. So it's there is something in the vein and it is occupying mass, and there's some fluid surrounding it. You know, this is the thrombus here, and the question is then how like far proximally it reaches. Now this is sometimes not so easy. Some of the stuff here might actually be artery, so we can try to find out about this here just in a second. But yeah, this is just to see the medial plantar vein, lateral plantar vein, and there is a thrombosis of at least down to here. Some of the stuff might be phlovoid, so you can then measure the distance. Yeah, let's find out how this looks maybe on a coronal non-fat saturated sequence. Basically exactly the same. We can see this stuff here, and then back there it's open again. And when we go here, the distal portion, plantar arch, when we go here, plantar arch is actually open. You know, whether there is a partial thrombosis here at the wall, it's difficult to say, potentially. And then here thrombosis again going up, and then this is the artery likely that's just going down here, posterior tibial artery. But let's find more out about this on the axial. So we can see here, let me go here, maybe we do even side by side, which should be good. So we can see here we are at the tarsal tunnel level. We have the vein, artery in the middle. There is some high signal now here in there, and the question is now, is this phlovoid or is this thrombosis? Sometimes this is not so easy. It depends a bit on how everything else looks like, whether there is edema, etc. I'm not quite sure, but here it kind of like looks different. And I think this one here is already also thrombus, and this is the phlovoid in the artery. So we don't mistake the artery phlovoid for thrombosis. And the veins around the ankle sometimes have quite substantial phlovoids, which can easily be mistaken for thrombosis. But here in this case, you know, this one here, I would, because, you know, it looks a bit funny, could be, but maybe it's too much for phlovoid. And you can check the other veins, they don't show the same things. But then again, back here, this also looks more like phlovoid in the veins. There is no periligamentous edema, so I would be more inclined to call this like a phlovoid of the veins. But then when we go down here, the signal changes, the diameter changes as well. There is now perivascular edema, and this looks more like this is not just the typical phlovoid. And then certainly down here, where we have this big black stuff here in the plantar aspect of the foot, this is clearly, you know, not phlovoid anymore or any longer. So yeah, so there will be a thrombosis here in the posterior tibial vein down to the lateral plantar vein. And so what is the medial one doing? So I said the lateral one, so this is the lateral one, and the medial one would be here. This is the tendon, and then, you know, we try to find something here, not quite obvious. Here it's going down, it seems to be enough. And this is a non-contrast study, which makes things also obviously easier, because we really sometimes get these phlovoids in the veins. Yeah, it's just something to keep in mind. Okay, but anyways, this is a thrombosis. Then T1, I'm not sure whether the T1 is actually of any help. We can use a T1 oblique here. And on the T1, what do we see? We see the phlovoid of the artery here. It's not going high enough to really make a call regarding the phlovoids, as you can see here, of the veins. But it looks like here there's also this low signal stuff. Yeah, it's not great. I would have loved to have a nice axle up there, but then down here you can see this is not phlovoid stuff. This is really something that's occupying the space, because this is the phlovoid of the artery, and then in the vein this is the thrombus here in the lateral plantar vein. Okay, but let's go over to a other case. So we have one more here, I believe. Yes, so we can go to this foot. This was the one that I showed you earlier with regards to the anatomy. Let me just find the transfers. We can do the same exercise. Now here we noticed, first of all, there is less volume of the veins. You can see this PD fat set here. There's no phlovoid really. And then down here we can see there's no what I call like occupying lesion within the vessel here in the veins. Even on the sagittal, when we go large here, and then we go to the maybe to the lateral side, because that's just the more prominent vein. So this is where we previously had the thrombus here. And I think the depiction can be easier if you focus on perivascular edema. And then if something's wrong in the vessel, there might be an indication that you actually are looking for a thrombosis. And then we see 2 pain markers. Sorry about that, stupid phone. Okay, so then from here we go, from here we go to the plantar arch. Here, there is also no thrombosis. Then we have the metatarsal veins going over. Let's switch on this side, so they are okay. And then now we see, first of all, there's a marker somewhere. So this was the first marker, and I think there's a second marker that's somewhere here. We don't see it now. Oh, there it is. Okay, so somewhere in the second ray, we see some edema here, and now we need to find out what's going on. So suspicious things here are typical plantar plate, Morton's neuroma, and the plantar vein thrombosis in the more distal portions of the metatarsal veins, where we have to transition to the digital veins. Now this is one of the differentials. It's very uncommon. It's not common to have this at this location. It's more frequent in the metatarsal veins, or then plantar arch, and certainly lateral and medial plantar veins. But yeah, so let's find out here. We see some vessels here, there, and then we see some edema here, and then very hard to appreciate, but you can see here this tiny black stuff here. It's not part of the ligament. It's not the tendon. It's actually where we should have the transition of the vein. So when we go more here, so metatarsal vein, let's follow the metatarsal veins here for a second. There now it becomes a little bit blurry, unfortunately, and then we start to see something black here, there, and then it's okay again, and then either some veins, or maybe there are even some additional cysts here. Hard to say, but luckily for us in this case we have a contrast study, or post-contrast study, which now makes things easier. We can start again at the back. Let me just zoom in. Artery, vein, then we have here the 2, so medial branch, then we go to the lateral side. This is the lateral malleolus. So we have the lateral plantar vein. They form the plantar arch. Now you can see the connection with the dorsal dorsal foot veins, which we did not cover in this video. So then always here corresponding like the artery as well, so plantar arch. And from here we have the plantar metatarsal veins, and now here some edema enhancement could be at the origin here of the joint capsule, etc., but we will look at this here just in a second. And from here we then have the formation of the plantar digital veins, which are not really the idea to actually see much there anyway. So let's go to the axial, and I will probably put this one in just for reference so that we know where in the forefoot we are right now. So, okay, so let's go to the second toe here, this one, and then we go anteriorly. So here we are. Okay, so let's go back to the metatarsal veins, or plantar arch, some phlovoids here. And the phlovoids are sometimes hard to separate from thrombus, I give you that, but perivascular edema is one of the criteria we can use. So we go now distally, we follow the second ray, plantar vein here, we see some subtle small artery in between, 2 veins. Now from here we can see, I probably need to make this much bigger, so artery, 2 veins, then vein, a lot of edema and enhancement around it, and then something's going down here, and then we start to see enhancement. Remember, this is contrast, enhancement around a non-enhancing structure here, all the way down here, and from here something that looks like a vein, plantar digital vein here at this point now, all the way to the proximal, then something in here. It's a very short segmented thrombosis at the junction of the plantar digital vein to the plantar metatarsal vein of the second metatarsal. Here even some maybe adjacent tenosynovitis and inflammation happening all around here, like a thrombophlebitis of this location, which looks really not good on the sagittal, and you can easily just call this, I don't know, maybe joint capsule injury or something like that. But I think the key is here, this is not a problem of the plantar plate or of the joint capsule or of the joint for that matter, but it's actually a problem of this thrombosis here. So this is a very tricky case, I give you that, but yeah, we also need to solve tricky cases. And these thrombosis in the smaller joints are not easy, first of all, and they're not just limited to this. We had one case in the virtual MSK fellowship where we had, where we find a or where we found a small vascular thrombosis around the shoulder joint. So that was a very specific case, very rare. It was the first time we've seen that. So yeah, just try to find stuff like that. And oh, that's why MSK radiology is so much fun. Okay, let's finish this. So now you should have a good understanding of the underlying anatomy, and also you know what to look for a plantar vein thrombosis and how to describe it properly. And if you really want to go deeper in topics like this, then you should check out the virtual MSK fellowship program. This is a program for radiologists that want to get advanced training in musculoskeletal radiology, that really want to build up their confidence, go to the next level, and also increase their reporting speed, which is a skill that you can learn. So go check that out. It's a separate homepage here. You go there, you can watch a free training video as well. And in that video, I'll explain to you why people are actually having sometimes issues with musculoskeletal MRI specifically, as opposed to, for example, neuroradiology and stuff like that. So go check that out. And then you are able to also book a call with me where we can discuss things. We can go through any questions you have about the fellowship before you make a decision, and basically find out whether it's even the right thing for you. So it's not for everybody. So we want to find out whether it's actually a good fit or not from both sides. Yeah, go check it out. And until then, I see you in the next video. Bye-bye.